All right. Hello, everyone, and welcome to an evening edition, a special edition of an LGBT Network live town hall. Tonight, we're going to be talking about a very important topic that's on so many people's minds about our schools, education, our schools, and COVID-19. How are we dealing with it? What's happening? We're going to we have some amazing, amazing guests tonight, including Roger Tillis from the New York State Board of Regents. We have Dr. Lauren Block, and we have a great panel of educators, teachers, parents, and students who will be sharing what their experiences are currently in going back to school or not going back to school at this point, and hear what some of the fears, anxieties are, and how we can move along together as a community as we deal with this epidemic that we have, this coronavirus. So just let me tell you a little bit about the LGBT Network again. My name is David Kilnick. I am President and CEO of the LGBT Network and founder. And this is a very important topic for myself as the founder of the organization, because just to give you a little bit of background, 27 years ago, I was a student at Stony Brook University studying for my master's in social work. And it came down to our last semester where we had to choose to either do a master's project or a master's thesis. And I know I probably shouldn't be saying this on a town hall about education and doing our homework and stuff, but when we had a choice between doing a project and a thesis, I was like, hey, I'm going to do a project because I don't have to write a big paper. And so the project that I did was to, and this is back in 1993 now, was to create a curricula to go into Long Island schools to talk about what it was like to grow up LGBT, particularly in the suburbs. And so, created this curricula, got into a few schools on Long Island. And when I say got into, sounds like it was a secretive mission and on the down low, which it pretty much was, and conducted this workshop in 7 different school districts across Nassau and Suffolk County, from Uniondale all the way out to East Hampton and some places in between. Now, no matter where I conducted this workshop in the 7 different school districts, what would happen at the end of every single class was that there would be some students who would shuffle their papers, they would hit them on the floor, they would delay leaving class so that everyone else would leave the classroom so that they could come up and ask me a question. And they didn't want to be seen, asking the gay speaker a question because someone could peg them as being LGBT and they were afraid of being bullied or being outed. So the kids did this in all 7 districts. And the question was the same, no matter whether it was in Western Nassau County, Eastern Suffolk County, or in between. And the question simply was, is there any place I can go just to meet other people like myself? So all these kids were asking for was a place to just be themselves, and there wasn't. And that's when I decided that we needed to do something about this, and I started a nonprofit called Long Island Gay and Lesbian Youth, also known as Legally. Fast forward 27 years later, Legally is now part of a larger network of organizations. It's the largest organization of the network, of the LGBT network, that provides a wide range of education, advocacy, support services to hundreds of thousands of people a year. But education is still a very key core component of what we do. We work with nearly every single Long Island school district, providing anti-bullying workshops, leadership training, helping to start gay straight alliance clubs, support for faculty, support for administrators, support for parent-teachers associations, you name it. We do it in pretty much every school district on Long Island. It's 110 of the 124 school districts that we've been in. We expanded into Queens several years ago, and we're now in well over 100 schools in Queens and some of the other boroughs, and we put on conferences as well. So, so education is really, really important. And by the way, the joke was on me. I had to write a 75-page paper anyway to do it. But I'm glad I did, because here we are 27 years later, still, doing our work for the schools. In fact, later on, we're going to hear from one of the LGBT network staff members talking about, the services that we used to provide in school, and that hopefully we'll be going back at some point soon. We're now doing virtually. So all of that stuff is going to be shared here tonight. And thank you all for joining us. Please consider doing a watch party so that other folks can hear this important information. And so, we're going to get started now. We're going to get started by bringing in one of our first guests, and I'm excited to have an author here with us today. tonight. She's not only an author, but let me tell you a little bit about her as she comes onto the screen here. Dr. Lauren Block. Hey, Lauren. Dr. Block.
Hey, tell me, Lauren.
So Dr. Lauren Block is a general internist and clinician educator at Northwell. Her research interests include trainee wellness, interprofessional education, and curriculum development. She sees patients in primary care, precepts residents, and teaches epidemiology, communication, physical diagnosis, and clinical reasoning at the Zucker School of Medicine. She is the recipient of many awards and honors, and aside from getting her bachelor's degree at Yale University, she also received her master's in public health at Johns Hopkins in Maryland and her MD from the Harvard Medical School. So lots of Ivy League education here. She is the author of 2 books. One book was released when the virus first hit and anxiety was at its peak, and not that anxiety has gone down, but we'll talk about that a little bit. Second book was released in August about talking to your kids about going back to school in the time of COVID, which is very relevant right now. Both books are free and downloadable. In our social media links where you're watching the show, we will have links for them available, and they should be going up shortly. And this is also where you can ask questions for all of our guests tonight. So welcome, Dr. Block. Welcome, Dr. Block. Thank you.
Thanks. Tonight. Thanks for having me. Thrilled to be on the show.
Thanks. So, you do so much. I mean, you do so much important work in the field of medicine, in the field of research. What was the motivation to write these books?
Sure. So I think a lot of us in the medical field, right, felt compelled to do, something to get the word out to our friends and neighbors and, people in our communities about what was going on with the pandemic. As you said, there's so much fear in the spring and nobody knew what the right thing was to do, right? People were wiping down their cereal boxes for this fear and not knowing how they should be acting and how to interact with their families and how to kind of get back into society in a meaningful way. And, speaking to our own 3 kids, we called our focus group. My husband and I, he happens to be in public health, saw that there were tons of books out there about every field of science, right? From the solar system to dinosaurs to every kind of grotesque animal imaginable, right? But when it came to this pandemic that had sort of taken over and really narrowed our kids' world, there wasn't really that much scientific information available. And our kids' lives had changed so dramatically. Our kids weren't going to school. They weren't seeing their friends. They weren't even seeing their extended family or their grandparents. And they were asking why. And, we asked a lot of them to not see all these people, not go to school, wear masks all the time. And we thought by helping everyone understand the science behind how the virus was transmitted and how to protect yourself, we could actually engage our kids in more of a discussion and help them understand what was going on in the world a little bit better.
So that's fascinating. So what has been the what has been some of the feedback that you've received from folks? What impact? I mean, I know it's had an impact, but maybe if you could share with our audience the impact that it's had and why folks should get the book.
Sure. So, I think one of the big things that we thought about is that we wanted this to be readily available on the spot, as a resource that parents and teachers could have, that teachers could read to their kids. I've had several patients who are teachers now tell me, hey, I read this to my kids in my class and it's been really helpful. So we wanted to make this freely downloadable so that cost wasn't a barrier. And then we wanted to make this sort of non-judgmental and, put the thought out there that everyone has a different level of comfort. Some kids are not going to be comfortable except in sort of virtual type environments. And depending on everyone's background and depending on what, illnesses the kids or their family members may have, that's okay. And everyone has to make the decision for themselves and for their families. Second, we thought that, since this did pertain to public health and medicine, we understood a lot of how the virus works, how it gets transmitted, what are some of the symptoms, what's going on in terms of treatment and vaccine development. And a lot of our friends and neighbors, even people in education, may not have that scientific background. So we wanted to get this information out there, not just for kids, but also in the hopes that their parents and their teachers would learn a little bit along the way, as we did, you know? And sort of between our first and second book, the language of the pandemic changed a lot. People all of a sudden started talking about antibody testing and herd immunity and vaccine development and all of these different treatments which were tried. And we wanted to share with kids some of this vocabulary so that they could have some of these conversations with their parents and friends and teachers from behind masks, you know, in a safe way. And then, like I mentioned, you know, we had our, you know, little focus group of our 2 8-year-olds and our 5-year-old at home who quickly told us, like, we have no idea what that means. You got to check that out. Or, hey, why didn't you mention, you know, the sort of Kawasaki phenomenon? You got to put that in. That's important. Kids and families want to know that. So it was an opportunity for us to share some of this information with our kids, with our family and community, and then with people in the world.
Well, you know, so it's I mean, it's in a way, it's a shame we have to say, oh my God, look, you know, a book based upon science and that, you know, you know, and epidemiology and, you know, so, you know, where this is made for kids, right, to understand. In one of the books, we'll talk about parents in a second, but, you know, how have, you know, a lot of this issue has become politicized, you know, and we'll get to that a little bit later, because I know that that's even made its way into the schools, you know, with, you know, teachers taking whichever side that they're on. They're like, well, maybe I don't have to wear a mask or whatever it is, you know. Are the kids smarter than our adults to some degree, or what have you seen?
I think kids are used to following rules, right? In a way that parents are not. And so we tell our kids, you know, this is how you behave in school. We sent our youngest, our 5-year-old, to kindergarten. And he had no idea what kindergarten meant, right? So we're like, you now are, you know, not going to run around like a madman in our backyard anymore. You're going to like sit at your desk and listen to your teacher, and you're going to wear shoes, and you're going to wear a shirt, and you're going to wear a mask. And it just became like part of what he was going to do at school. He was going to put his backpack, and he was going to bring his little hand sanitizer. And to him, he really doesn't know any different. And I think our hope was that by explaining to, you know, our kids and more kids out there why they need to do this, how masks actually stop the spread of the virus in a way that was visually appealing and that they could sort of relate to, they would say, okay, not only are these like rules that I have to follow, which is kind of annoying, but this is actually going to help not only me, but it's going to help my family, my friends, and help me stay in school where I want to be, because I'm sick of being at home with mom and dad like I've been for the past 6 months. And so we were really lucky that we had, you know, an illustrator who could like bring these viral particles right to life, these antibodies with their swords and their shields to life, as we kind of had to illustrate how the immune system works and how people get sick, but most people do get better and then have some protection from getting sick again.
Yeah, that's fascinating. You know, and before we move on to talking about, you know, the second book, you know, about how to talk to your kids about COVID. You know, what are some of the things that, you know, as a clinician, have you seen or heard about some of the anxiety that kids are facing? You know, because, or is it just that they're told what to do now? These are the rules, and this is the way that it is now. And you know, I mean, the younger generation today, the younger generations, I should say, are used to being like on the phone and on iPads and their Android devices. You know, so it's nothing new for them maybe to communicate. I know when I was growing up, you know, we didn't have such a thing. You know, the first cell phone that we had the long antenna that you had to like, you know, extend. So, Have you seen any issues of anxiety in children being forced to quarantine and maybe not see their friends as much or not be in school? What have we seen out there?
So I think, I think there's been a lot of creativity, right? I think we've all had to be really creative in terms of like how to keep our kids busy and learning, and happy during these months. And so I think all of us have gotten a lot better at every board game and every art project and crafts project. And we have made a lot of use out of technology to stay connected to each other. I think one of the things, there's a lot that we've sort of shared with our friends in education from a scientific background. I think something that my colleagues in education have shared with me is that kids see our anxiety as grown-ups reflected, and then they will mirror that. So if we as parents express confidence that, yes, you're going back to school and your school is going to do the right thing, and your teachers are all watching the news, and all of us are going to do, our due diligence to keep you safe, our kids believe us. And so I think we, my husband and I, made a vow to try to remain positive and optimistic and be honest with our kids, in a hope that we wouldn't inspire fear, but instead, optimism that isn't this amazing how we've all come together. We've all sort of, flatten this curve in a way that many fewer people have gotten sick than we were fearful of, and that our levels in our own area here in New York are so low that we can actually send everyone back to school confident that we can keep them healthy. And we know now what we need to do, and it's pretty simple. Let's stay 6 feet away and let's wear masks. My 7-year-old said to me the other day, like, why is this so complicated? You spoke, David, about sort of the politicized environment. She's like, we just have to wear a mask and stay 6 feet away. Like, why is everyone making such a big deal? And I'm like, you're right. When you think about it, it is pretty simple. And if we can explain it in a way that generates optimism and hope and confidence, then hopefully a lot of that negativity and anxiety will fade away, especially once people get back into their routine and feeling productive.
Yeah. I mean, no pun intended, but it's elementary, right?
Right.
And it's simple, and the facts are out there. And I think it speaks to a larger issue of on humanity and how we feel about not only taking care of ourselves but taking care of others too. And I think we're at a real turning point, where we really have to make a decision who we are as a nation, as a community, and as human beings. And listen, this is a once in a century type of thing, that has happened, and it wasn't something that I ever thought about at all. But when it's here, you listen to the scientists, you listen to the health professionals, and you, like you said, the kids, your kid said, what's so difficult about this? You put on a mask. They're making them all designer now too. You can get your favorite sports team on there. I mean, and so it's elementary, but what we've seen is, leadership matters, right? And so, leadership and who we listen to matters. And it's important to listen to the Dr. Fauci's, the Dr. Blocks, and other folks, because you're looking out for the best interest of everyone, and focused in on science, and that's important. So, when we have our panel come on later, I mean, we'll talk a little bit about what's happening in the schools. And, I know I have heard from both from family members and friends who are teachers in high school, that they're having some challenges where, some kids and some teachers at some points don't want to wear masks, and it's all related to politics, And so, but, when we're talking about a public health crisis, that comes first, not someone's personal views. This is a public health issue, right? So, so I don't know if you want to share share anything what I've just said, or you can move on to the next question.
Yeah, no, I think it's a great point, right? Because this is a public health issue. So this is not just about each of us. It's also about protecting each other. And, one of the things that we tried to highlight in the book is that, yes, we're doing this for ourselves and for each other, but we're doing it for our elderly grandparents, right? Or some of the people who have medical, chronic medical conditions who, we live and work with. And this is our job. And we can all have a really important role to play in keeping everyone safe by just doing what we think is right. And then by supporting the people who are doing the hard work, responding to 911 calls and being there in the supermarket and, working on vaccine development and, being part of the fire department that gets called, right? There's so many local heroes that we can support as they do their everyday job, so that they are as safe going to work as possible and they can come home and take care of their families.
Yep. And I think that's real important. We're talking about, there are some people who can't stay at home, like, other folks, our first responders, folks like you in the hospitals and healthcare institutions, our supermarket workers, our postal workers, and so on and so on and so on. And so our EMTs, and so it's real important that, we really view this in the lens of taking care of all of us, right? And so, and protecting all of us. So with that, I know there's a lot of questions from parents. It's like, what do I say to my kids? How do I talk to my kids? And, what you said earlier was real important, just to be honest, right? And to talk as plainly as possible. But what can you offer to folks out there who want to, if they haven't, 6.5 months into this now, what are some ways that they can talk to their kids now with, the way that things are now? Because like you said, it's changed. We know a lot more. There's a lot of unknowns, I guess, going into the fall and winter. But, what can parents say to their kids?
Sure. So I think it's, not that different than what we've been saying all along, right? Which is that if we're sick, we're going to stay home. We're going to wash our hands. We are going to, stay away from people who are coughing. We're going to now wear our masks, which is not necessarily that different than if one day we weren't feeling well and we went to the doctor's office. We're going to go to the doctor now if we get sick. Thankfully, we're in a very different place than we were, 4 and 5 and 6 months ago. There are tests available. We can get tested, and this is what it looks like. And if you get sick, let me know, and we will get you tested. And most people are okay. And if not, there are treatments. And this is what it'll look like if you do get sick. And this is, what's in store for us as this vaccine gets developed and we start to talk about how it's going to get rolled out to everybody. And this is how vaccines work. This is why we get the flu shot, and you may be going to get your flu shot from your doctor this year in particular, right? As well as the measles shot and some of these diseases that were huge pandemics, like you said, hundreds of years ago, and we no longer even think about because they've been effectively eradicated with vaccines. And this is an opportunity to think about how these vaccines work and why it's important that all of us, where possible, get vaccinated so that we can create herd immunity and lessen the number of people who are vulnerable to some of these diseases. So I think this gives an opportunity to talk about sort of public health, some of the basic measures from, hand washing and covering your cough and staying home if you're sick that we've always talked about, and then add in this other lens in a way that now people are listening. I see my patients that, you talk about the flu shot and most times people roll their eyes, and now people, more people are saying, you know what, I do not want to get a fever this year. I never want to get a fever, but this year that would be terrifying. If there's anything I can do to lessen that chance, let's do it. So I think this, like you said, is an opportunity to just be honest, share what you know, and then just share that we don't have all the answers yet. Hopefully we certainly have more now than we did, and hopefully we'll have a lot more answers in the next 6 months.
Yeah, and so I think it's important, like you said, to just talk about what we do know, right? And what we do know is very important. There's ways that we can protect ourselves and protect others, and that these are the things that we should be doing in terms of personal hygiene and, when we're in public, the distancing, et cetera. Now, would you, do you have any, would you deliver the same message to talk with your your teenagers the same way, or would there be a different tack perhaps? Because teenagers may be kind of, and sorry to the teenagers who are in the green room and that are going to come on, this is probably not you, but, may be a little bit more set in their ways.
Yeah, no, I think it's particularly challenging, right? I feel really lucky that, my kids are little and that we can sort of portray things as really kind of concrete for them. And I think with teenagers, I think it's trickier, right? Because it's a tough time for all of us, but particularly if you are, figuring out your way in the world and figuring out what it is that you want to do and who you want to be. And I think, like has always been the case with adolescent medicine, right? It's about risk reduction, right? So we can't control everything that everyone does, but if you want to see your friends, okay, see fewer friends, see them outside, try to stay a couple of feet away. Wash your hands when you get home. If you feel sick, stay home, right? So it's maybe a little bit less about absolutes and it's a little bit more about here are some easy ways that you can still do the things you want to do in a way that reduces your risk as much as possible. And by following as much of this as you can, hopefully you will be able to keep doing whatever it is that makes you happy, whether it's playing music or seeing your friends or playing sports. Here's a way that we can have you keep doing it safely for as long as possible, particularly when we're living in an area at this point that has a low level of cases.
Yeah, and it becomes, thank you for that. It becomes a little more challenging for us in working with our LGBTQ youth, who, there could be particular challenges that, when folks were had to quarantine. Some, we know because we work with the kids that some of the kids were stuck at homes that weren't supportive, right? So here they were forced to stay in homes where they felt like they couldn't be out, or maybe they couldn't join one of our virtual programs because their parents would see that it's legally, or the LGBT network, and the need for community, to have a sense of community, a sense of belonging, a sense of connection, in a way was kind of stripped for them, and we had to look at it in a different way. And so there's also, and we're going to hear from our speakers later on, but that not everything virtually that was set up via Zoom or GoToMeeting or Teams, or all the different platforms that we have were made for recognizing and supporting and honoring who people were in their in who they love, in their gender identity, and et cetera. So there are other challenges, and maybe we could actually talk about another book and do it together about for LGBTQ youth. I didn't think about that beforehand, but
I would love that. Yeah, no, this touches, as as you sort of so eloquently described, this touches so many people in different ways, and everyone has their unique challenges in all of this, and as well as strategies that they've used, be it social media or groups like this one that bring people together to feel connected, even in times where it's hard to have some of that human contact that we all kind of need to thrive. So I think it's a great story, and it's a great thought for another book to come.
Cool. So is there anything else you want to share with us? We appreciate not only for coming on to, the town hall tonight, but for all that you have done to help so many people and continue to help so many people. So thank you.
Thank you. Thank you so much for having me. If anyone is interested and wants to download the book for free, it's at our website, kellystays.home.com. You can also purchase a softcover version on Amazon. And we look forward to everyone's feedback and ideas for books for the future.
Excellent. So thank you, Dr. Block. And we are going to put those links up on our social media. So everyone go and either download it or go and support by buying the book on Amazon as well. And if you go on Amazon, go on to Amazon Smile and choose the LGBT network as your organization. And this way it's a double good thing to do. So so thank you, Dr. Block, and we look forward to talking again. Thank you. Cool. So that was some really good information. And and we'll continue with Dr. Block, bringing Dr. Block.
You're on live.
Bringing Dr. Block back. And it looks like we got Roger Tillis on the screen already. So I am excited to have Roger here with us tonight. Welcome, Roger. How are you?
Hello. I'm sorry I'm late, but I'm not as technologically oriented as some of the rest of you.
Well, you're here, and that's the most important thing. So
I got it. And all my sins, I got to start over again today.
Doesn't that always happen as soon as the fast is over?
I know, but I have to remember this a year from now. That's all.
I always say, like, once the fast is over, it's like, give me 5 minutes and then I'm starting all over again, you know. But so welcome, Lashana Tova, as well.
Thank you.
And let me just tell you a little bit about Roger. Roger Tillis is a member of the New York State Board of Regents, a longtime education leader in New York State. He's currently serving his 4th term on the New York State Board of Regents, a top attorney, a top investment leader, a fighter against injustice, and just a great person all around. So we're excited to have Roger with us here tonight. Thank you. I know you are so busy, so thank you for taking the time to be here with us tonight.
There's not a whole lot of places I could go. It works out. And I really, I think the work that you guys do is very significant, and I'm glad to be part of it tonight.
Thank you. So, I think if we could start out by just talking about what the Board of Regents are. I think many people know what, superintendents, their school district, principals, people get that, especially on Long Island, right, with all the school districts that we have. So what is the Board of Regents and what role?
Well, it's very interesting. The Board of Regents is a lot more than I thought it would be, or that virtually everybody I've talked to says it is. We are an organization that there are 17 of us. We are elected by the state legislature, and we represent judicial districts. I represent the 10th judicial district, which is all of Nassau and all of Suffolk. Wow. My district is twice as large as the next largest district in the state. Because they have not split up Nassau and Suffolk in terms of judicial district. We have 125 school districts on Long Island. We have over 600 schools. I have been a regent, this is my 16th year, and I've been to over 100 of the districts and over 300 of the schools. And I love that part of it. And I thought that's what the regents did. Everything from pre-K through 12th grade. But I found out when I became a regent very quickly that we approve all programs for higher education institutions.
Oh, wow.
We license 50 professions, everything from doctors and accountants to midwives and land surveyors. And we also not just set the parameters for those, but we discipline those. So every month we go through a report and we have to decide whether people are living up to those expectations. We also charter every museum, library, and public television station in the state, as well as running our own library, museum, and archives in Albany, which handle about 800,000 people. I am chair of the Cultural Ed Committee, which handles all of those issues, museums, libraries, public television, as well as arts education, because that's a field that I have particular interest in. We also have we have Access, which is all of the adult education programs, from GED programs to vocational programs for people who have ability problems, and we therefore have a tremendous portfolio, which makes it very interesting. Every month is very different, but in the last 6 months, all we have done really is to focus on our K-12 schools and how to open them and what kinds of things we have to do to open them. And that's been quite an exhausting experience, because every time we think we have something complete, the ground shifts under our feet. And it's very much like shoveling mercury with a pitchfork. There's a whole bunch of issues that I will talk to about if you want, but sure. Health and safety comes first. And frankly, on the health and safety business, that is more the governor's office and the Department of Health that sets those parameters, the distance, the masking, the ventilation systems. we work with them on that, and we have to know what's going on, and we work with our schools to make sure they're doing it, but we don't set the policies for that. We set the policies for everything else in education.
Mm-hmm. So that's amazing. I mean, I just learned a lot more than I knew about the Board of Regents.
Yeah.
I mean, that is just absolutely tremendous. What you do, and and the cultural ed committee, I think, is a very important one. I think there's a lack of there's not as much for cultural educational that we're seeing in our schools, and we know that. I'm very proud that I went to CW Post, or now Long Island University, and was able to take part in the Tilla Center as part of a rich institution that served us certainly when we were students at Post and beyond.
We are the largest provider of arts education on Long Island, and I'm very proud of that. But I started a group called the Long Island Arts Alliance about 15 years ago, which brought in virtually all of the arts groups. From centers to museums to arts community organizations, and we now have about 150 organizations on Long Island working. And in fact, we work very closely with the education community. For me, it's not really taking off one hat and putting on the other.
Sure. Before we get to the, to the whole host of issues that you alluded to, which I think is important to get to, how has the, coronavirus impacted arts programs and cultural programs? I mean, in a big way, I would imagine.
It's devastated them, absolutely devastated them. I know our center, we haven't had a concert or a program since February. We also have, and most centers don't, but we had 40 schools that had graduations scheduled. We had no summer program. All of our programs have been canceled through at least January, and there's no income. There's expenses. The nonprofits in general have done have had a very difficult time. The arts institutions have had, there are very few programs of federal aid or state aid, and anything that we get at this point, we meaning the nonprofit community, comes really from foundations or individuals, and I think you probably have found that as well. It's very difficult to survive now, but we will, because the Tilla Center is part of a great university, which also is having problems, but at least we are, part of a much greater whole.
Yeah, I think you bring up a very important point. It's a very difficult time for all nonprofits, and because the expenses haven't gone away, whether it's a facility cost, we run community centers, right? So our community centers still have rent. It doesn't matter. That hasn't gone away, but we're not able to open them. We had to cancel every single fundraiser that we've had. I know that at this time of year, talking about the Tilla Center, I know especially when I was a student leader, I'd be getting ready for the gala at the Tilla Center in October, I think. Right. And so for us, we had to cancel everything. So it's a tough time, but I think, like you said, somehow we'll come through together. And I think part of that's going to have to be being innovative and doing more things together. Perhaps sectors within the nonprofit industry looking at joining together that we may not have looked at before. So.
Right. Collaboration is very important at this point.
Yeah. So the issues, what are the issues that are happening?
Well, there's so many. The biggest one is because we have at least 3 different types of education going on. And parents have gotten to choose which they want, whether they want their kids to go back to school full time, if the district is able to do that for health and safety reasons. Some districts are not, but virtually all districts have at least some of the kids going back to school some of the time, and we call that the virtual blending. So kids might stay home for 2 days a week and then go into school 2 days a week, and a different set of kids would go the different 2 days, and then the fifth day might be a teacher prep program. Teachers have been remarkable on the pandemic. They have had to learn basically a new profession, and how to do it well. And they have really made a superhuman effort on this, and I give them a lot of credit. But even those that have programs at home, the virtual programs, there's different kinds of ways that districts are doing it. Some are doing every single class on a Zoom call from the teacher, so that they have 8 subjects a day, and they'll have 8 teachers doing Zoom classes. Others will have a camera set up in the back of the room, and so the broadcast will be made of the teacher in front of the students. It's not a Zoom call. The interaction is not as great. And some districts have packets. They don't even have the ability to have any kind of virtual interaction. For one, there aren't enough Chromebooks to go around. This country has had a shortage of Chromebooks for the last 6 months, when for some reason our president cut off with tariffs and whatever else to China, who makes most of the Chromebooks. We have now, I've got districts, I was talking to people in Wyandanch, Hempstead. The districts that have the highest needs are the ones that have the need for the greatest number of Chromebooks or devices that one can hook up to. In addition, there are fewer people in those districts that know how to do it. And I understand that very well, having had my problems getting on tonight. But there are some places in the state, in fact, quite a few places, not so much on Long Island, that don't have any broadband, that don't have any Wi-Fi at all. Some of the companies are setting up hotspots so that they can have some modicum of training. But it's been such a chaotic experience, because when a school opens, and we've had over a dozen on Long Island that have opened for classes that have closed already, because it is very hard to keep students from mingling with each other, or having other kinds of work at lunchtime or whatever else. And so whenever a student comes down with the virus, are usually non-symptomatic, that whole cohort that the students are in must quarantine themselves. The school closes for a couple of days, they disinfect the school, and it's troublesome. It's even more troublesome for the adults who are in the school, who have more symptoms of disease, so they're more worried about it. We have virtually all the teachers who were over 50 and didn't want to work because they were nervous about it, worked in a different way. They would do the virtual classes. And so districts have tried to be as flexible as they can. We have had to change rules and regulations on teacher certification to allow districts to have more flexibility, such as getting substitute teachers. And I think Newsday had a big article on that this morning. Has been a very difficult job, because in general, our education schools across New York State are down over 50% in the last 9 years.
Wow.
And there's a lot of reasons for that. Much of it comes from the disastrous effects we had of the Common Core rollout, with teachers being demonized and demoralized, and a lot of people left the profession at that point. Others left because 10 years ago or 12 years ago, there was a glut of teachers, and a lot of teachers couldn't get jobs, so they went into different professions. Now we have, within the next 6 years, New York State is going to need 180,000 new teachers.
Wow.
And we have half the kids in the education schools that we had before. And so we've had to loosen up some students in education schools are actually becoming substitute teachers. And we've had to make that available. It's in addition to all of these issues of teaching online and teaching in school, I have tremendous problems, and and some of my fellow regents do as well. We had on Long Island probably one of the most segregated school systems in the country, and the segregation is by economics and racial. And so we had, when you have that, you have some of the greatest districts in the country, if not the world, sitting right next door to districts that have the highest needs on Long Island or elsewhere in New York State. And the examples that I give, because I brought the Regents to Long Island, you have Half Hollow, district next to Wyandanch, or you have Garden City next to Hempstead, and there never the twain shall meet. There's no common ground on those. And as a result, you have basically, I think, two systems of education in New York. You have a system, and the problem is that we give one state assessment test for no matter which district you're in the past. And it's been very unfair. And there's very little equity between a kid who is getting taught with no AP courses in their school, with one counselor for every 500 kids, versus kids that have 25 AP courses in the school and one counselor for every 50 kids. And the expectations in those school districts are very, very different of what they think their kids should do. So you have a kid with the same level of intelligence in one district having very little chance of making it, and the other district having every chance in the world. That has been exaggerated by the pandemic. And that's what's really frightening, because the districts that are the highest needs districts, as I mentioned, many of them don't even have the devices to have virtual learning.
Right.
And they're still having packets that they put a call out, and the parents will pick up a packet on a daily basis so the kids can do their work and then bring them back at the end of the day so the teachers can look at the packets and see what work has been done. That kid is not going to get the same kind of education as the kids who are getting Zoom classes of everything that they have. In addition, you have the other issues of gangs and lack of role models in many cases, lack of mentors. It really is a very, very different system of education. And until we get some kind of equity, probably through the courts, because I don't see one district giving up or making sure that the district next door, those kids have the same opportunities. I think that at some point a court is going to have to do that. And every year I go, and it becomes more and more difficult for me to watch some of the students who are wonderful. I am so fortunate, because out of those school districts, over 100, when I go to a school district to visit, I have one request. We don't get paid as a regent, but I do when my kids were in elementary school, I went in 3 or 4 times a year and read poems to their classes, which to me was a great, great fun. The only perk I have as a regent is that when I go visit a district, I ask them to make sure I talk to a 3rd or 4th grade class, and then I read poems to them. Well, I learned something that should be so apparent, but isn't always apparent. I learned that the first 6 months I was there. When I go to a district, some of the highest needs districts, and read poems to those 3rd and 4th grade kids, they could be in Wyandanch, they could be Hempstead, they could be in Garden City, they could be in Great Neck. and the kids react just the same. It's amazing that they're with it, they memorize, they interact, and they're enthusiastic about these poems and about education and learning and the excitement of it. But when you go to a ninth grade class in virtually all of the highest needs districts, and you see the lack of education going on, lack of interactivity, and the teachers are trying their best, but because of all the other factors I mentioned before, these kids have basically gone down into a chasm, and you just see it every day, and you say, how is this possible on Long Island, which is renowned for its great schools, to have some schools being so underutilized and understaffed and undereducating. So those are issues that we have.
Yeah, and those are huge issues, and I think that how the pandemic has brought to light not only the health inequities, but has really shown to a lot of folks the education inequities that exist, and and it being tied to economics and communities of color, that we have such a segregated island, is really apparent, and you say, like, how can this happen on the island? All one had to do was watch the debate last night to know how this happens in our country when you have a president. Again, this is, we can't say this isn't political. You can't talk about politics. It is, and that, when you have a president who's saying that they're not going to denounce white supremacist groups, and in fact, telling them to stand by, when we have, when the issues of just racial injustice overall, with the killing of George Floyd and Breonna Taylor and so many other people, you can't ignore this. And it's very apparent on Long Island, right here at home. And I know that I mentioned it in the last segment, and we're going to have, and I hope you stay with us, a panel of teachers, parents, and students coming on to talk about their experiences. But I know, from friends that I have that are in school and, that are, have their cohorts one day, and they have the video, the cameras up in school so people could watch at home too. And, and the students are supposed to be wearing their masks all day. And teachers that I know are reminding students to, pull the masks up, and then they're screaming, Trump, Trump, Trump. We wonder why, that, we have this, this segregation, these inequities, and I think that, it's all coming to a head now, and it's a decision that we will make to address it and change it. And I think it'll happen in the court. Yeah.
I was on the State Board of Education in Michigan many years ago. So I think I'm the only one in the country that has been on two different state boards of education. But in Michigan, we had one of the greatest education systems in the world, very close to New York. We followed a lot of what New York did. This was 40 years ago. Betsy DeVos and her family, the Amway family, came into Michigan and destroyed the Michigan education system well after I left. But I've talked to the present Governor Whitmer and Jennifer Granholm. And this family took over basically the politics of Michigan and basically demoralized the whole school system, which is now has many charter schools, a lot of for-profit charter schools, for the sake of moving towards privatization of all public education. And she's been a terrible Secretary of Education, and we need to replace her.
Yep, and there's one way of replacing her, right? So.
Yes. Well, there are other ways, but they're not legal.
So, but we will do the legal way, right? And I think that and we say, the other town halls that we have aside from this, we have a regular series going on until Election Day, are our Vote Proud New York town halls, and we're not telling people who to vote for, right? We're laying out the issues. We hope folks can critically think and see the two different paths that we can go down, right? And make their own choices. But it's about getting out to vote, and that's the legal way to do it, as long as our right to vote is protected, which we will make sure of. But so one last question before we bring on the panel, and then I guess, if you have time to stay with us.
I'll do that.
Speaking of politics, I mean, how much did, or did it not? Because we have a governor Governor Cuomo, who is really focused in on the science and the disease and taking action, to shut down where we needed to shut down and reopen, at times where the levels of infection was at a certain rate, and et cetera. But has politics at all, how difficult has it been to make the decisions that you have had to make at the Board of Regents with politics, either from national or Long Island is Long Island politics, so it could.
Yeah. We and other agencies who are funded, much of which comes from the state or local, even local, know that we just haven't had the funds. And in order to carry on the regular duties of a school district, it requires at least the money we've had in the past. Well, we've had so many new and expensive ways of doing education right now. One school district said it cost $5 million to open, just with the ventilation systems and the extra buses, the extra teachers they need, the moving of the rooms around. Well, it costs $5-6 million for a school district to do that. At the same time as the governor is now faced with the problem of a budget that is almost $20 billion in the hole, and has to make decisions. Where in the state budget is this money going to come from? Because it has to come from someplace.
Right.
As opposed to Washington can print their own money, and has done so with some of the packages they've had, and they're the only ones that can. So Cuomo has to figure out where he's going to make the cuts, and he's announced that education could have up to 20% of their state aid cut, and that would present huge problems, and especially if we're looking at the equity issue, because a district like Great Neck, my own district, has about 4% of their funds coming from state aid. So if they lost 20% of their state aid, it would be less than 1% of their budget. Hempstead has more than 50% of its money coming from the state aid. 20% cut there would be huge, and would really almost shut the district down, in addition to the fact that Hempstead, Roosevelt, and Uniondale, to some degree Freeport, have a big problem because the charter schools that are open in their area, in Roosevelt and Hempstead, are getting 100% of the monies that they were entitled to, because they get the same amount of money per student as the districts did, but based upon the non-cut of portion of the district. So they're not getting cut 20%, which means that over 25% of Hempstead's budget will have to go to charter schools. Wow. And it's going to be a terrible burden, for a district that is struggling anyhow. These are things that the federal government needs to come up with, this package that is being negotiated for the last 2 months, that will help not just education, but education being one of the major issues that has to be resolved with that. Unless that federal government does it, we're going to have a problem. Now, one reason to change the government is that there will be hopefully a better move to do that after January. Yep. And then we'll have, if there's both houses and a president that has different philosophies than what we have now, I think we will have some federal help. It has to be. Yep. And not done on partisan basis. I can't believe that anybody could get away at the federal government saying, well, all the blue states shouldn't get money and the red states should get money, or the blue states have sucked up all the money. And it's crazy to have to deal with the partisan politics on issues such as education and health and other things. So
I agree.
I'm venting.
And I'm listening and venting with you. And just right before we bring on the panel, let me just add a little bit to that. Is that Long Islanders who are so adamant about their school districts, right? We live here because of great schools, and we pay such high taxes because of great schools. When you go to the polls, remember who's fighting to bring that money back to the schools now, so that we don't see these tremendous cuts in what, people say is so important to them. So take a look at, who is obstructing right now, particularly out on the east end of Long Island, in Congress, and who is not. And so, remember what's important. Remember what's important. And we know education and our schools is very important on Long Island. And if that's the case, if we want to see it continue, New York needs its fair share of money to do it. There's grave danger of human services as well being, decimated in both of our counties and the state. So with that, let's bring our panelists on. I don't know who's here, but let's bring our panelists on. I have a list. Let's see who comes back on screen because they've been so patient in waiting for us. So as they come on, and as our production team in the back is bringing them on, don't worry so much about the lower thirds. Let's just get everybody up on screen. We have a couple of teachers, parents, and students joining us. We have Tracy Hunt Marshall, who is a teacher and coach at West Hempstead High School, as well as the GSA advisor. So thank you so much for that. Tracy, welcome. Thanks. We have Rachel. Rachel McKelvey is a student at Pearson Middle High School in Sag Harbor. So we're really covering it from west to east on the island tonight.
Yeah, for sure.
Welcome, Rachel. Thank you for joining us.
Thank you.
Let me see who else I got here with us tonight. We have Juliana. Juliana, hello. Is also known as Jules, and is a student at the Stony Brook School in Stony Brook. And I think that's all of our guests here with us tonight, right? Did I catch everyone? Why don't we bring Robert on as well? Because as we start to talk about, what is available here in our schools. And Robert will be joining us. And when you see him pop up on the screen, he's the vice president, executive vice president and chief operating officer of the LGBT network. And he's going to be able to talk about, some of the programs that are being offered to our schools, teachers, and students now to help support and continue the important anti-bullying. So welcome, everyone. It is great to have a full screen here, and such very important viewpoints. So let's start with our students and teachers. You've heard what Roger Tillis has said and what Dr. Block has said. Are you back at school now? And if you are, how are things? And let's start from there. So whoever wants to go.
I'll start. We're back. The teachers are back full time. The students are every other day. There are also students that chose not to be back full time. I'm happy to be back. I'm happy to see the students, but it's an awkward thing because you are seeing the students from at home and live at the same time. So it becomes a little bit of a challenge to teach both. I teach phys ed. So most of my students that are at home are doing their own workouts and they send them to me videos. But I know speaking to the teachers, the English teachers, social studies, it's very challenging to teach the students in class as well as the students out of class. So I know that's a challenge for most, I'm sure. I think the students see that as a challenge, but I also think it's good for the students to be back if they're comfortable, like listening to Dr. Block. I think everybody has a different comfortability with being back and do they feel safe? But I do think the big thing for teachers is to make sure we do keep the students safe. I mean, the parents are sending them back and trusting us to do our best job to make sure we do keep them safe.
Excellent. Thank you, Tracy. And Rachel, how's it going out? How's it going in Sag Harbor and at Pearson?
So I'm actually doing full remote because I wanted to keep my family safe. Um, but I go in these Zooms and I see both the kids in person and online as well. Um, and I will say it is very awkward. Like it's very different. And I'm a senior, so it's even more different because since I've already gotten a lot of requirements done, I only have two Zooms, only two classes per day. So I feel like with the online learning, sometimes there's a lack of structure, but at the same time, I don't blame these teachers. I mean, they had to adapt so quickly, and so have the students.
Mm-hmm. Interesting. All right, so we're going to follow up on that a little bit more soon. And Juliana, how is it going at the Stony Brook School?
So for me at Stony Brook, I'm fully like back in school. A lot of people did choose to do fully online, and then some are doing like half and half, I'm pretty sure. Um, but yeah, like Rachel said, it's really weird seeing some people in class and then just a bunch on a screen. But it's going better than I expected.
Oh, okay. All right, that's great to hear. And Rachel, what is it that you miss most about being in school? About yeah.
Yeah, I really miss like the actual in-person social interaction, probably the most. And last year was especially hard for me because there wasn't scheduled Zooms that much. Like it was all very do it at your own pace with the sort of deadline. And I was also dealing with some like mental health issues at the time, so it was really, really hard to keep up with everything and get help at the same time. Um, and so this year it is like much better than last year, but I do miss like being in person and since I'm a senior, it does kind of suck that I won't have a prom or anything like that, but it's better to be safe than sorry in my opinion.
Mm-hmm. Mm-hmm. And thank you for sharing that. And not being able to have that connection. And living in Sag Harbor, we've heard from folks. I mean, we have a community center in Sag Harbor,
Yeah.
but that is pre-pandemic, you could feel isolated, right?
Yeah.
Yeah, and so it's a little bit more exasperated here. But speaking of prom, we never know, right? Got to have hope that maybe by June next year that we'll have a prom, and that hopefully the LGBT network can have its annual youth prom as well. And
Yes,
Tracy,
that's
maybe if you could share a little bit about what is the greatest change that you've seen now being back being back in school that is different from the spring, when just everything had to be abruptly shut down.
I think that teachers are way more prepared than they were before. And it is very nice that we have, Zooms on a schedule and that there is at least some structure to it. I know I have two siblings who are one is in elementary school, the other is just starting high school. So I see how it also affects other students. I mean, my younger sister will have like 8 Zooms in a row for each period, and my brother will kind of have the same and then, go on different Zooms to meet up with guidance counselors and such. So it's definitely nice that it's kind of like, okay, this is an actual school day. Like it's not just staying at home and doing nothing. Like you have to actually participate.
Mm-hmm.
But at the same time, for people like me who need more structure to thrive, when you only have two classes, it gets it's hard to motivate yourself and it's hard to do things on time if you don't know how to really structure your time yourself.
Mm-hmm.
Um, and it's also very different with all the counseling. I'm applying to colleges and stuff, and I can't really see the guidance counselors in person. And also, a lot of these colleges are doing online stuff instead of in person stuff. Or, for example, one of my friends up in Brockport, she was enjoying, her first year at college, and then all of a sudden they were like, okay, we're gonna have to move you and your roommates somewhere else completely because 4 kids got COVID, and now we have to quarantine them in your room. You have 1 week to move out.
Mhm.
So that's kind of scary to me,
Mhm.
especially hearing about students who are quarantined because they got COVID, and they have to stay in their dorm for like 2 weeks or more. It's something that you have to consider, when you're a senior, like whether it's worth it or not to really, go for your favorite college and get accepted and go there in person, or if maybe you need to take a gap year. It's hard to make that decision right now.
Yep.
Can I make a
I was going
suggestion?
to say join in.
Yeah,
Yes.
just on that issue, I've been one that is very worried about not just colleges but also K-12 schools closing up again once that they're open. But so many of the colleges are doing online teaching that I've seen a lot of the kids who would be going to, the top schools or the schools of their choice, be it, upstate or any other place, either doing one of two things. One, staying home and going to a local school, which at least saves them the room and board. But many of them are going to schools that have had online teaching for many years, and the schools that I would not have suggested to anybody more than a year ago would be, as in Arizona State or in the University of Phoenix or whatever. They've had good qualified online teaching, which is not the best way, but it's better than some of the colleges who are going out and having online teaching with teachers that have never done that before and are charging the full tuition. You might be paying $60,000-$70,000 a year when you could be paying less than $10,000 a year at one of these schools that have had good online teaching in the past. So in addition to a gap year or in addition to going to work for a year, a number of students are taking the route of taking courses at a less expensive school and then going to their favorite school, hopefully by next year. I'm not sure that we're going to be ready to go until the end of this year.
To the end of this year or next year?
End of the school year.
End of the school year. Okay. All right. So thanks for sharing that. And Tracy, maybe if you could talk about, what it was like to, how things are different now versus when, and it's completely different, right? Because it was such an abrupt shutdown in March. So, how's it different?
Well, March was crazy. I mean, we kind of got told, all right, you got to try to go live as much as you can. I mean, I'm a phys ed teacher. So I tried to think about what the kids, what they do. They're big into social media. I made an Instagram account. I taught a workout, kind of like a brief video explaining the workout, and then I went live every day to teach it. Not every student joined. A lot of teachers joined. I figured I'd given free personal training, I think. But it was, kind of transitioning each day and getting comfortable really in the camera. I mean, I never thought I'd be videoing myself and putting it on Instagram for people to see live. But it seemed like a lot of the students joined, the parents joined. I think every teacher was finding different ways. The older teachers, I would say it was a really challenge for them with just the whole live. A lot of teachers didn't feel comfortable going live. I think it was important for the students to see us. That was the main reason, although I was a little uncomfortable. I also try to put it into their perspective that they need to see their teachers. It was great. They sent me live videos as well of them working out, which is cool to get to see students. We did some projects where they sent videos explaining stuff, so I think it was good. But I think now most teachers have kind of fine-tuned all the way because we kind of knew going back that this was going to be a challenge. But I think the biggest thing for districts to do is professional development on getting different ideas to help the teachers because it is challenging. I mean, it's, as the student said, it's awkward. It's weird. I mean, you're teaching live, and it's like I'm taking attendance to people at home, looking at them, and then looking at the class. So I can't imagine what it looks like to the students at home. So I think, as much as it is a challenge, I think you can't stress, like, Rachel said, she's, less for her family, keep herself at home. And I think we have to see that every student may feel differently. Maybe somebody has an older parent or a grandparent that lives with them. And there are different reasons why students are at home versus being at school. But I think for students to see the teachers, I think it is great that everybody's going live now. I do think it's important.
Yep. And so has, and Roger, please feel free to jump in anytime, but, West Hempstead has a very large Orthodox community, right?
Yep.
And I imagine that a lot of and we've seen, outbreaks in different parts of New York State recently with large Orthodox communities. Has the school district, and I don't know if you could talk about this, but has it been politicized? Has this issue been politicized, or is everybody really good? These are the rules. This is what we do.
I think everybody's been following the rules. I will say I was a little curious to see, like, high school kids, would they be really following the rules about wearing a mask? I will say all the students so far, I feel like, have been really great about it. And if somebody isn't, please protect yourself and everyone else. I think it's important for you. And, the students, I will say, I have to say, most of the students have been excellent with it. I know you were saying about, politics come into play. I don't think we've seen that. Obviously, you hear teachers speaking. I do know some people's beliefs. But I think, I can't say enough when I hear teachers talking about, not to go into politics, I just think our job as educators is to be supportive of all students, no matter who you are or what you are. Like, so it boggles my mind, I guess, to see some teachers' viewpoints, I guess I should say. I don't know, it shocks me. I can't even wrap my head around it, to be honest.
Yeah, a lot of it doesn't make sense these days. Let's welcome Christy Evans, who just joined us. Thank you, Christy. Christy is a dedicated isolate mom who wants to make this world a better, safer place for her child who identifies as trans. So welcome, Christy. Thank you for dealing with the difficulties we had in getting you on screen here, but we have you, and I think a parent's voice is very important. You've heard a lot about what we've talked about, and so from a parent's perspective, how has this been for you from March to now? Have you seen any particular challenges for your child? I'm going to leave it open for you to share.
Sure. Thank you for having me. And I apologize about the internet issues here, but that's like the way of the world now. March to now has been very difficult. I can tell you that I wish that finding toilet paper was our biggest problem, but it's been way more difficult than that for us. So my child, as you said, is a 10-year-old transgender boy. He's my son. And, it's really been a struggle on the virtual remote learning, more so than I think for other kids. So, in March, like everyone else, we woke up and we were working from home and trying to do this remote learning from home, thinking that the Wi-Fi would be the biggest problem. And then when my child went to log on to the websites for the school, they all had his birth name. So that was, I think, the biggest letdown, I guess, for my child, that he logged on and then he saw his birth name on there. I have to say the school district has been amazing. They've really been supportive of my child. And anytime we brought something to their attention, they really did their best and continue to do their best to make it a safe place for him, which we really appreciate. But at the same time, it was impossible to get any schoolwork done. Our biggest problem was that my child wouldn't do anything because it said his birth name on the screen.
Hmm. So and first of all, thank you so
Sorry, I
much.
don't know if my computer keeps freezing.
It goes in and out, but it does for the guests on MSNBC and CNN too. So this is, first of all, thank you so much for being the mom that you are and being supportive of your son. And I think bringing to light some of the challenges for our LGBTQ children, particularly our trans children. With some of the issues that you just mentioned, it's great that the school district is supportive, but have they explained to you, is this technology, or why is the birth name on there instead of his name? And I don't know if we lost you. We see you moving. All right. So as soon as Christy comes back to us, we'll pick up on that. But
David, can I ask a question? I'd like to ask
of course
of you and the panelists. Before the pandemic, we noticed it wasn't that hard to notice that over the last 3.5 years, I don't know what that signifies, but the evidence of bullying in schools had significantly, almost geometrically increased. Maybe there was a role model at the top that people looked at that wasn't great, but and we were really concerned. We had at the state level, we tried to pick up some programs that would have more social emotional teachings and issues, and try to deal with some of the issues on a little more forceful basis than we have. Since the pandemic, how has that shaken out in terms of the kids are not in school all the time? Is there the same amount of bullying, or is it different kind of bullying, or is it online bullying the way it is many places? Curious.
Yeah, I'll add to that in a little bit, but how about the rest of our panelists? What have you seen? If anything.
So, before the pandemic, I myself have been a target of bullying before, not just for my sexuality, but other things. But I have, I'm a supporter of my younger trans friends, of my other LGBTQ friends, and I've watched them been harassed and bullied, called slurs, made fun of, had their crushes, completely humiliate them in front of people. And I will say that, yes, bullying is something that still happens. And some people find it acceptable, or, they use oh, it's just a joke thing to justify it, which is very upsetting. And I think a lot of it comes from a lack of education. And I will say that I haven't seen personally as much bullying as before, and I think that's because a lot of kids aren't in contact with one another. But I've still seen, people making fun of each other online. So I believe that it has changed because people, can't really do it in person as much. Although at the same time, this is sort of a chance for them. Well, I feel like it's kind of decreased in person because people, of course, somebody who's insecure, who uses other people to raise themselves up by putting them down, if they're not really with that many people most of the time, like, they're really not going to have that many targets, and, they're not always going to have the attention on them as much either.
So they're not going to have as big of an audience, I guess you're saying. So, Juliana, and then Tracy, what have you seen, if anything?
So I think through this whole pandemic, with people not really going out much and being on social media a lot, I think it's educated people a lot, which is so important. So me personally, I've actually seen a lot of people who didn't really know much about our community like become really strong allies. And it's like, it's just makes me so happy.
That's great. That's great. Thank you. And Tracy, listen, you're the GSA advisor, right? So, what have you seen, or what have you witnessed or heard from other folks?
I have to say, for the most part, I mean, the kids come up to us and do talk and tell us stuff. I haven't seen much, even since the quarantine. So I don't know if that's because they're home. They said not really much, even on like the social media, which is a positive thing. I have a pretty good group of GSA kids and like a lot of allies, I have to say. Maybe I think it helps a little bit. Pretty vocal to the students. I try to put myself, if I hear a student say something, I'll say I'm personally offended. I use myself instead of the students to try to explain to students, like, think before you speak. I mean, I think it's great that Jules says that she sees less of it. I think it's still out there. I think it's more, like you said, like having education and educating the teachers and the educators to, not just to not pay attention to certain things. If something comes up, maybe that's a, great moment to maybe teach the students and explain what happened. Because there's so many teachable moments that I think teachers don't want to speak about because maybe they're nervous to bring it up or something, but I think it is important. But I think the LGBT network does a great job. We've had them come in, we've had other speakers come in, but I think educating the staff would help all the students in general, to begin with.
So is there still staff development, days, or are they concentrated around like, online instruction or online learning instead of perhaps when we would have come in to do some faculty trainings?
We have mostly right now virtual. They are keeping almost all the professional development virtual right now. In the past, we've had, the problem sometimes with these professional developments are the teachers that go to them are the ones that already are great advocates for the students. You need it really to be a mandatory professional development, I think that's a really important key for most districts. Because I'll go to them and I'm like, oh, well, these people that are here, they're already great advocates. I mean, the students know, I'm sure Rachel and Jules would say, I think the students know what teachers are supportive. I don't think it's hidden, like maybe the teachers think that they don't know. I always talk to the students and they're like, we know who supports us. I don't know. I can't stress enough. I talked to my assistant principal. She's phenomenal. She hung, when Ruth Bader Ginsburg passed away, she hung a rainbow flag in my gym and said, with everything going on, I hope you know that we always support and will always support all students, which I think is amazing. And we have the Human Rights Campaign, Human Rights Equality flag in our gym. And now we'll have the rainbow flag to go with it. So I think it's important to have those upper, you're talking about the assistant principals also be supportive, because I think when the students see that, it's even that much more to see somebody of a higher figure in the school support them. And she is probably the most supportive person I've ever met, which is amazing in a school district, I think.
Well, that's great. Leadership and role modeling really makes a world of difference. Robert, the question was, and we know the answer to this, right? That Roger asked, have we seen, we know that bullying has been a tremendous issue, since really our inception 27 years ago as an organization where we started in the schools, and Roger, you missed the beginning, but, where our organization is in 110, I always say 124 districts. So now I'm glad I know it's 125, but that means there's one more for us to get in. But, we're in 110 of the 125 school districts, usually regularly. And so, where we'll provide the workshops, trainings, youth leadership work for the Gay Straight Alliance clubs, support the advisors, support the faculty, support the PTAs, and now it's a little bit different. And we thought, okay, we probably won't hear as much from not having the contact about bullying, but it's been quite the opposite, actually, from what we've heard. And Robert, maybe you could share a little bit about really how bullying has taken on the form that education is living in today, which is online, and that the amount of calls we're getting about it that would sometimes would rise to the level, actually, Roger and everyone else, of hate crimes. So although our hate crime statute is pretty poor and we need to improve that. So Robert, why don't you share a little bit about that and perhaps some of what we're doing.
Sure. David, thank you so much. And thanks to all of our panelists too for joining us. Since we've gone virtual, connecting and keeping connected with so many LGBT youth and really learning that bullying, even virtually, has continued, and that cyberbullying still exists, and that, as people are working and schooling and learning and connecting even more online, that people are being bullies from the comfort of their own homes. And they feel like that protective barrier of being virtual really enables and empowers them to be bullies. And so really being able to support LGBT young people in this virtual space. We have groups every single week for that support, and really especially working with GSA advisors and GSA leaders to make sure that GSA clubs can continue and to be able to provide that level of support within a virtual school community, or a hybrid school community, to make sure that LGBT youth who are bullied have that support network in place, as a really critical function of a GSA club.
So, one of the things that we have heard, and we've all learned, something new. I mean, I knew Zoom because, as a part-time gig, as an adjunct faculty, I've been teaching online for Fordham University for the last few years, and we use Zoom. So Zoom wasn't new to me, but Discord was, and I see our youth smiling. So, and so, that's a place, I guess, where people play games, right? There's all kinds of things that go on Discord, and we've heard from a lot of folks, a lot of young people, about being bullied in those platforms as well. On average, we're getting about 3 to 4 calls a week about this, which is a lot, when you're virtually, right? Whether it's about being bullied or whether it's about being abused, there are some really serious stuff that we're hearing from our young people. Also, a big increase in what adults are facing too in their communities. So the answer, Roger, is it's so good to hear the good experiences, right? Because that's so important that folks hear that, because if they're not experiencing that, that gives them hope. And perhaps as we gather again here virtually before we can all get back together, maybe we could share with them things that they can work on, and certainly they can reach out to the LGBT network for that advocacy within their school, within their class, within their district.
Well, it certainly doesn't help to have the leader of our country not vilifying extremists, white nationalist extremists, and others, because I mean that affects everybody. I mean, I know the ADL went out immediately and took them down for it. But when kids see that, I was sitting with some kids last night watching that thing, and if it was embarrassing, but it was also a lot of teachable moments in there. But if there were teachers there to express it, how can you go to a kid and tell them this is the way to behave, and take down people and call them, you're stupid and whatever else. Yep. It's just a crisis that we really need to all confront. And I know the regents are actually going to be meeting on some of that in a week and a half, on some of the issues, the social emotional issues that kids are having in schools.
Well, that sounds great. I mean, if there's anything that we could help to provide, just let us know. And I think what Roger said is real important. Is that again, this wasn't meant to be political, but you know what? It how can you not talk about it? Especially when you heard last night, the president of our country not denouncing white supremacist group, whose name was Proud Boys. Now, when we talk about pride, we talk about it in a very different way, right? We talk about it being inclusive of everyone, no matter what gender, no matter what sexual orientation, no matter what race, religion, and so on and so on and so on. And that's what pride means, not a white supremacist group. And so, we do need to have these teachable moments, which are right out there, and whether we could grasp that opportunity online right now, is another thing. Like, I know I do it in my class, but it's with I teach an MSW class at Fordham University. So that's what our profession's supposed to do, is fight for economic and social justice. But so very, very interesting. So is there, in these last few minutes, too bad we don't sell commercials, but in these last few minutes, is there anything that anyone else would like to share with us and to leave with our audience who's watching us out there? Robert.
Thank you, David. Hearing about the challenges as well as the successes, and I think also people, expressing it and looking for opportunities to be supportive. I want to make sure everyone knows that next Friday, October 9th, the LGBT Network is celebrating its 19th annual National Coming Out Day campaign. And this is a campaign that is designed to engage communities of people to take a stand for and to come out in support of LGBT people where they live, learn, work, play, and pray. And schools are always kind of the top organization that participates in our campaign. So I encourage everyone to participate. You can go to reptherainbow.org, as where our campaign will be all virtual this year, and find different ways to participate. You can sign up an organization, you can personally sign up, you can download materials to share online, your own Zoom virtual backgrounds, and all the different ways to really quote unquote rep the rainbow, sharing information online, and also taking our Safe Space Pledge that is chock filled of information about how to really advance that visibility, the social justice and equity for LGBT people in all different types of spaces. And obviously we're talking about schools. And so being able to run this campaign both virtually and in person to be able to show that support, because I think the thing that was said before, it's so important, seeing different people in a school community and people at different levels in the school community coming out in support of LGBT people and students really makes a big impact. So reptherainbow.org next Friday. Thank you.
Yes, Rep the Rainbow. And so it used to be called Wear the Ribbon, which if you go to that weartheribbon.org, you'll get to Rep the Rainbow. And so, but, that's where last year, I forget how many institutions, but the campaign that we started here on Long Island, right, in Long Island schools, because it was a school-based campaign for the first 16 years, I think, right, Robert, or the first 15 years. Has expanded to where the New York Islanders participate, Newsday participates, and large scale institutions participate, and it's gone international. So, everyone out there, you can get involved the same way. It helps to spread the message of love, and also to coming out to support LGBTQ folks where we live, learn, work, play, pray, which is everywhere, right? So, I know Tracy and the West Hempstead GSA has participated for so many years. Pearson has been very involved. I think the Stony Brook School also has participated in the past. So it's an opportunity to do a campaign virtually and educate and allow everyone. It doesn't matter what your sexual orientation, doesn't matter what your gender identity is. It doesn't matter what any identity is that you have. It's about us all coming together as one to make sure that we have safe spaces for LGBTQ people and families. So I want to thank our guests so much. Roger Tillis for not only being here tonight, but the incredible work that's being done at the Board of Regents. I'm glad I know a lot more about it right now, about the comprehensive nature, and that's to put it mildly, of what you do and what the Board of Regents does. And I hope that we're here for you if you need anything, any support now and into the future. And to our faculty member and GSA advisor, Tracy, thank you so much for supporting our students and for making sure that the GSA exists. and to our incredible students, Rachel and Jules. Keep up the great work, the great advocacy, and we know that we'll be working. Well, we'll see each other eventually at our community centers, but until then, we'll be doing stuff virtually to continue the great leadership that you have. So thank you, everyone. Let's continue to stay safe, and remember that we have a town hall next week. Our Vote Proud New York Town Hall, which is a special National Coming Out Day edition with Lieutenant Governor Kathy Hochul, who will be joining us for the full hour. So come on in, and for any folks who are here tonight, if you want to come on and tell your story with our Lieutenant Governor, we'll be reaching out to you to do that. So next Wednesday, October 7th at 5 p.m., join us here, and here is wherever you're watching this now. So thank you so much. Enjoy, stay safe, and we will move forward together, uniting as one. Thank you.
Thank you.
Have a good night.